Hi guys. So some of you have got some tightness into the lower back, into the glutes, and maybe a bit of the IT band. So this stretch is wonderful for you. I call it the Windscreen Wiper. They've all got fancy names and I've renamed them all, as you know. I would have shown you this in the treatment room. You're going to lie on your back with your knees bent. Your arms are coming out to a T. So keep the knees bent roughly hip width apart, but it doesn't matter. You're then going to windscreen wiper those knees from backwards and forwards, but nice and slow. You're not going too fast. Just windscreen wiper, just to massage out that lumbar spine, that lower back a little bit. You're then going to just let your knees flop. So I'm going to my left. I do not want the knees stacked, so an angle is best here. I'm then going to look over to my right, so my head is looking in the opposite direction of my bent knees. If you wanted to take this stretch further, you place the left foot onto the right knee and have a few deep breaths there. This will really intensify the stretch into that QL muscle, that lower spine, the glute, and the IT band on your leg. Have a few nice deep breaths there. Once you're there, you do not have to have the foot placed on your knee. You could have it just as you were to begin with. It's totally your choice to however you feel comfortable. Do not overstretch. If you have got your foot placed, release the foot, bring your feet up and engage the belly button whilst you're doing this. You'll then want to rearrange your pelvis because you would have twisted. So come back to central. Rearrange yourself, have a few deep breaths in center, and just windscreen wiper those knees from side to side again. You're then going to let the knees flop into the opposite direction. So I'm going to the right, turning my head to the left. If you want to take the extra stretch, place the right foot on the left knee to encourage that knee down a little bit further, to again stretch out that QL muscle in the left side, that lumbar spine, the glute, and the IT band on your left leg. Have a few nice deep breaths here. When you're ready, if you have got your foot placed on the knee, take the foot off of the knee, bring your feet up, your knees up, have a few nice windscreen wipers again. And when you're ready, come up to center and then roll yourself to the side so you're getting up nice and gently, using your arms as paddles onto all fours, pushing up, and then you're done.